When you hear the words heart attack, what image comes to mind? For many people, it's a dramatic scene from a movie. Someone suddenly grabs their chest, collapses to the ground, and desperately calls for help. But what if a heart attack didn't look like that at all? What if there was no crushing chest pain, no dramatic collapse, no obvious warning? What if the symptoms were so mild that you mistook them for fatigue, indigestion, stress, or simply getting older? This is the frightening reality of a silent heart attack. Some people continue working, exercising, driving, or even sleeping through a heart attack without realizing what's happening inside their bodies. And by the time they finally seek medical attention, valuable time may already have been lost. So what exactly is a silent heart attack? Why do some people feel almost nothing? And what warning signs should you never ignore? Let's explore the science. What is a silent heart attack? A heart attack, also known as a myocardial infarction, occurs when blood flow to part of the heart muscle becomes severely reduced or completely blocked. The most common cause is the buildup of fatty deposits, called plaques, inside the coronary arteries. If one of these plaques ruptures, a blood clot can form and block the artery. Without enough oxygen, heart muscle cells begin to die. In a typical heart attack, reduced blood flow triggers symptoms such as chest pain, shortness of breath, sweating, or pain that spreads to the arm or jaw. A silent heart attack follows the same biological process. The difference is that the symptoms are absent, mild, unusual, or simply not recognized. In other words, the heart is still being damaged, but the warning signals are much harder to detect. Why do some people feel almost nothing? This is one of the biggest questions in cardiology. Scientists don't yet have a complete answer, but several factors may contribute. First, pain is highly individual. Two people can experience the same injury and describe completely different levels of pain. Second, the location and size of the affected heart tissue may influence symptoms. Not every heart attack affects the heart in the same way. Third, some medical conditions can alter how the body processes pain signals. One of the most important examples is diabetes. High blood sugar can damage nerves over time, a condition known as diabetic neuropathy. If the nerves responsible for transmitting pain signals are affected, a person may not experience the classic symptoms associated with a heart attack. Age may also play a role. Older adults are more likely to experience atypical symptoms, and in some cases, symptoms may develop gradually instead of appearing suddenly. The symptoms may be easy to miss. A silent heart attack doesn't always mean there are absolutely no symptoms. Sometimes the symptoms are simply so subtle that they're blamed on something else. For example, a person might feel unusually tired for several days. They may think they're overworked. Another person might experience mild discomfort in the chest and assume it's acid reflux. Someone else may develop shortness of breath while climbing stairs and blame aging or poor fitness. These symptoms may seem insignificant when viewed individually, but together, they can tell a very different story. Warning. Sign number 1. Unusual fatigue. Extreme or unexplained fatigue is one of the most commonly reported symptoms in people who experience atypical heart attacks. This isn't ordinary tiredness. It's a level of exhaustion that feels different. Simple activities suddenly become more difficult. Walking short distances may require more effort. Tasks that were once easy may suddenly feel physically draining. Persistent fatigue should never be ignored, especially when it appears alongside other symptoms. Warning. Sign number 2. Mild chest discomfort. Movies have created the impression that every heart attack causes severe chest pain. In reality, chest discomfort can be surprisingly mild. Some people describe it as pressure. Others describe heaviness, tightness, squeezing, or fullness. And some don't experience chest symptoms at all. The absence of severe pain doesn't automatically mean everything is fine. Warning sign. Number 3. Shortness of breath. The heart and lungs work together to deliver oxygen throughout the body. When the heart struggles, breathing may become more difficult. You might notice that climbing stairs suddenly leaves you unusually breathless. You may feel winded after minimal physical activity. Sometimes, shortness of breath appears before chest discomfort, and sometimes it appears on its own. Warning sign number 4. Nausea or indigestion. One of the reasons silent heart attacks are so dangerous is that they can mimic digestive problems. Symptoms may include nausea, stomach discomfort, indigestion, heartburn, upper abdominal pain. Many people assume these symptoms are related to food, but if they're new, persistent, or accompanied by other warning signs, they shouldn't be ignored. Warning sign number 5. Pain. Outside the chest, heart attack symptoms don't always remain in the chest. Pain or discomfort can spread to the jaw, neck, back, shoulder, one or both arms. This is known as radiating pain. Because the heart shares nerve pathways with other areas of the body, the brain may interpret the discomfort differently. In some cases, jaw or back pain may be more noticeable than chest discomfort. Who is at greater risk? A silent heart attack can happen to anyone, but certain factors increase the risk. These include diabetes, high blood pressure, high cholesterol, smoking, obesity, physical inactivity, a family history of heart disease, increasing age. People with multiple risk factors should pay especially close attention to unusual symptoms. How do doctors detect a silent heart attack? Sometimes a silent heart attack is discovered months or even years later. A person might visit a doctor for an unrelated reason and learn that evidence of a previous heart attack appears on an electrocardiogram, or ECG. Doctors may also use blood tests, imaging studies, stress tests, or other diagnostic tools to evaluate the heart. This is why routine medical checkups are so important, especially for people at higher risk. If you experienced unusual fatigue and mild chest discomfort, would you recognize it as a possible warning sign? Subscribe to Curiomedix, where curiosity meets science, for more evidence-based healthcare education and fascinating medical discoveries.